Hi, welcome back to Museum Dental's Dental Insurance Information Session. My name is Maria Correa and I am Director of Operations and Patient Advocacy at Museum Dental. My experience is in the insurance benefit coverage. I have over 25 years of experience in this field and am highly knowledgeable in all aspects of coverage, including what many of you don't know and the topic that I will be covering on today, which is accidental dental coverage. Many of you do not know that you actually have this within your healthcare benefits. So let me try to break this down for you. In your healthcare benefits, you will have your dental package. As well, throughout your healthcare package, there is a clause in there that actually reads accidental dental coverage. What this refers to is usually an external hit to the face. So let's say, for example, that you're at home and somebody opens a cupboard and hits your face. You end up with a chipped tooth, or you end up needing a root canal, or anything like that. Most dental offices, when you go, they put the claim through under regular dental benefits, and this should not be done so. The reason being is that if for any reason it is an eligible expense that isn't covered under dental expenses, then you will not be reimbursed. However, under accidental dental, there is a better coverage, and usually, in most cases, it is covered at 100%. So I always advise patients that, if for any reason you, had an accident of the sort, and in a few cases, it doesn't have to be an external hit. It could be something as simple as, eating into a muffin and, all of a sudden you bite down on something that was in that muffin that you purchased that you didn't even know about. So in those cases, that also gets covered under accidental dental. We had a patient who was eating some cereal, and there was a stone in the cereal that they bit into, and fractured a tooth vertically and ended up needing an implant and everything. So again, that got covered under accidental dental. And the coverage under accidental dental is usually close to 100%, whereas crowns are generally covered under the regular dental benefits at 50%. So there is a big difference when it comes to actual coverage. So I just want to make you aware that this coverage exists and that it is very broad in what they consider an accident. So, if you are in a situation where, it was unexpected and something happened that was not of your own, situation, then by all means ask. It doesn't hurt to ask, and it doesn't hurt to file. The worst that can happen is you file and they don't accept it under regular accidental dental, and you have to then turn around and file it under your regular dental benefits. So I always advise patients that, if they had something happen, that they should inform their dentist and immediately. And you should come in for an emergency exam. You should also come in and have full mouth done of x-rays to cover that area to ensure that nothing else is, damaged or traumatized area. We've had patients that, have fallen down the stairs, or another patient fell off their bike. So those kind of situations, you want to make sure that all teeth are covered, not just the one that you think has been injured or traumatized. Okay, so it really is important that you get to your dentist, as fast as possible after such an incident, so that we can take a full mouth X-rays and also assess the damage to your entire teeth to see whether or not there are other areas of concern. We file a report, and in doing so, in filing this report to accidental dental, we usually have up to a year, so that in some cases you may not feel it immediately, but months down the road you may end up needing a root canal or something on a tooth that you didn't expect from that fall. And under your regular benefits, it wouldn't get covered. So under accidental dental, it actually does get covered. So this would be something that I would definitely make sure that when you contact your dental office, that you inform them of the accident. It is very beneficial to you, and I definitely would inform the dentist so that he makes notes and takes down the actual location and time and date of the accident. as you will need this for further filing to your insurance company. Okay, so for today, that's all, and I look forward to seeing you again for my next topic. And if you have any questions, please feel free to email me, maria@museumdental.ca. You can also feel free to follow us on our blog and our Twitter account. Look forward to seeing you next time. Take care and see you at Museum Dental. Bye for now.